Hello everyone, thank you very much for coming to listen to me. My name is Flavio Finger and I'm going to talk to you about the COVID-19 pandemic in Herat, Afghanistan, where I've spent some time over the last month. So overall, Afghanistan has a population of 32 million with a quite high number of internally displaced people. There's also a high number of people who live in Iran and Pakistan, and there have been a lot of returnees over the last few months, especially in weeks 10, 11 and 12, you can see here on the right. That's also weeks where in Iran there has been a lot of reported COVID cases, which is thought to have contributed to the beginning of the outbreak in Afghanistan. So overall, the first confirmed case in Afghanistan was on the 24th of February in Herat, actually. And up to now, there have been 38,000 cases and 100,400 deaths reported. As you can see on the right, by now, the number of daily new cases have gone down a lot. And you can also see that the peak was around the early June, when there was a religious holiday about 1 or 2 weeks before. Kabul and Herat are seen as the centers of the outbreak, highest incidence rates of over 290 per 100,000 population. The countrywide seroprevalence estimates, they have been published quite recently by the MOH and WHO, are of over 30%, which makes over 10 million infected actually. So 10 million infected estimated through seroprevalence and 38,000 confirmed. That's a very big difference, as you see. Now I'll focus on the province of Herat. So the population of Herat is over 4 million, with 500,000 about living in Herat city. There have been 6,000 confirmed cases and 228 confirmed deaths. What has to be said about death here is that those deaths are only the ones that happen in hospitals, since deaths in the community are not reported in Afghanistan. There have been a high number of healthcare workers as well, and you can see on the right that by now the number of confirmed cases have decreased since June, also the number of hospital admissions. Sample positivity has also decreased. We are now at about 50% positive samples. It was over 90 in June. In Herat province, we have a seroprevalence of 44%. This is equivalent to 1.7 million, which is also a very big difference from the number of confirmed cases. The COVID response was set up as follows. So we have people from different health facilities coming into triage at the Herat Regional Hospital, a major referral hospital, where MSF had set up a triage facility. I'll talk about this a bit later. And then people, if they needed to be hospitalized, were sent to 3 different COVID treatment centers, one of them run by MSF, and the 3 centers had different admission criteria. Liberty Hospital is closed by now, the others are still open. So the MSF Triage and Screening, how it worked. So people were screened for key symptoms, cough and fever at the entry to the COVID-19, to the Herat Regional Hospital. Then if they were suspected at that screening stage, they were seen by a MSF doctor who confirmed if they were suspected or not, and who categorized them, if they were suspected for COVID, into mild, moderate, severe and critical cases according to criteria based on respiratory rate and oxygen saturation in the blood. We have used this screening as a bit of an additional surveillance system, that is to actually have some additional data, because, as I said before, confirmation was only a part of suspected cases could be confirmed because of lack of lab capacity. So the number of patients we saw at this triage has decreased a little since June. We have seen a total of 5,300 cases, with now we see about 50 to 100 patients a day, and they're open 24/7 since the 24th of August. The proportion of severe and critical cases dropped from 15% in July to about 5% around now. And as you can see on the figure here, there is two ways we can define critical and severe proportions. One is based on the clinical decision done by the physician, and the other one is based on purely numerical criteria on the oxygen saturation and respiratory rates. And you can see that in the beginning they were quite a bit different, but now both of them have dropped to below 5%. Risk factors we saw at triage were unsurprisingly age, male gender, hypertension, cardiovascular disease, chronic lung disease, and diabetes. And so at our Herat, our Gazhar Gah Hospital, there have been 122 admissions since the opening on the 28th of June. 3 deaths, 18 transferred and 76 cured, and 15 defaulters were among those. Most of the patients came from our triage, but also from private and public health facilities. Duration of stay was a bit lower than expected, below 10 days, mostly average is 3 days. And about a few weeks ago, I was there implementing the clinical database with which we can follow the clinical evolution of patients and also their treatment, which will give us a bit more information on the actual evolution of patients. As conclusions, we have a stable low numbers of cases in several surveillance indicators, as I've shown you. We have high seroprevalence throughout the country and specifically in Herat. There is a massive gap between the number of infections that we would expect from the seroprevalence surveys and other surveillance indicators. So there is about 250 times more infections estimated than the number of confirmed cases. We have similar conditions since June in terms of transmission, but transmission strongly decreased according to the surveillance indicator. And there has also been no increase in transmission during Eid al-Adha, another religious holiday that was at the end of July. So we think that there is probably an effect of immunity limiting the transmission at the moment. There is no reliable data in Afghanistan on global and specific mortality because the deaths are not routinely reported. We would need surveys to address this lack. So in terms of immunity, I said that immunity at the moment is likely limiting transmission, but it's to be noted that immunity is probably geographically unevenly spread and patchy. So there may be localized outbreaks, or it's even quite likely that there will be. There will also probably be prolonged periods where we see low and intermediate levels of transmission ongoing because the immunity is still not so high. It's high but not huge. And the duration and level of protection from acquired immunity is not yet known. Upcoming colder seasons may favor transmission through direct and indirect effects. By indirect, I mean that people may gather more indoors than they do now in summer. The number of cases and deaths reported in Iran are also still quite high. So for all these reasons, surveillance systems need to remain in place so that we can anticipate future waves and future localized outbreaks. Thank you very much, and I would also like to thank the team in Herat for all their help.